everybody who has joined us. And I would like to kick it off to our speaker to go ahead and get started and introduce themselves. Thank you.
All right, well, thank you so much, and thank you, Every Dog, for having me. My name is Sameera Nalla, and I am a veterinarian, and I'm also a resident of the American College of Veterinary Behaviorists. I'm going to be getting into or finishing my second year of residency here coming up this fall. But for today's presentation, as you can see, it's called Did You Hear That? Helping the Sound Sensitive Dog. So going on to the next slide, just a little introduction about myself. So I was born and raised in a very small town in rural Minnesota called Worthington. And I lived in Minnesota for 30 some years before I moved here in Virginia for my residency. But my undergraduate, I did my undergraduate at Carleton College, also in Minnesota, where I studied history and neuroscience. Um, After that, I went to veterinary school at the University of Minnesota. And after I graduated from there, I spent 4 years in small animal general practice until I eventually got my residency here at Animal Behavior Wellness Center in Fairfax, as well as Richmond, Virginia. And I began that in 2023. And just so you guys know who I have at home, these are my critters. I have Otter, who just turned 6. He's a 6-year-old male neutered Staffordshire Terrier mix. And then I have my 2 kitties that I got in like my first month of vet school, a couple weeks apart from each other, Miko and Loki. All right, and with today's presentation, I thought it'd be really helpful for us to just start with some background information about the topic at hand. So, I wanted to go over just some definitions that are how we think about things when we see patients come through our doors. And so when we're talking about anxiety, anxiety is the anticipation of a danger or threat. Sources may not be identifiable. Anxious behavior, it can be exhibited in the absence of whatever the eliciting stimulus is or maybe was previously in the past. As far as fear goes, fear is a whole body response to a perceived threatening stimulus, and it involves physiological and behavioral and emotional elements. It is associated with a specific stimulus and can lead to anxiety. And then the last word is phobia. And phobias are persistent, maladaptive, and out of proportion fear responses to the stimulus. And then, so when we're talking about noise phobias today, with a noise phobia, many dogs who experience stress when faced with a noise are not necessarily noise phobic immediately. And so for the purposes of this webinar, when I'm talking about noise phobia, I am talking about, how we might think of noise reactivity or sensitivity or aversion. I'm just using noise phobia as kind of an overall umbrella term. So, um, but with noise phobias themselves, we define them as a profound and persistent excessive fear of noises that is abnormal in relation to the context that it is presented in. Phobic responses, they can range from you're just totally catatonic to completely manic, can be anywhere on that spectrum. Phobia can persist beyond the duration of the noise event or stimulus itself. Phobias or those noises can become associated with other triggers. So say the first time a dog hears a firework in a certain room and had never heard of those 4th of July fireworks before, it may, after the 4th of July has passed, the following day, not really want to go into that room where he or she first experienced that noise event. Animals may show a sense of anxiety or fear before the noise even occurs. especially if there are certain things that predict that noise is going to happen. So, for example, I had a dog as a patient who got very nervous about the owner cooking in the kitchen because that had elicited in her apartment the fire alarm going off. So when she would start up with any of the cooking appliances, that would be enough to lead to that dog wanting to just get out of there and have kind of that fight or flight response of being in the same room. All right, and then the next slide is what actually happens to our bodies when we experience that sort of trigger. In this case, we're talking about noise events. But there is activation of the sympathetic nervous system, which will lead to different physiological changes to our body, which is associated with the release of epinephrine, aka adrenaline. And that is what regulates our fight or flight, or you might have heard of the freeze fidget response as well. And the list I have on this slide is not totally comprehensive, but some of the changes we might see when that stress response system is activated is behaviorally, we might become much more hypervigilant and very aware of our surroundings. We might become avoidant and just want to get out of there. And we can even use aggression. In terms of aggression in dogs, it very much is used in dogs as a distance creating tool. And so if we are scared and we want to get away from the thing, that could be a strategy that we utilize to cope. We can also see cardiovascular changes like an increase in heart rate, respiratory changes like an increase in our breathing rate, some metabolic changes with our stress, HPA axis changes, steroid, glucocorticoid release. Our GI system can be affected with things like inappetence. Anxiety is very much appetite suppressing. Vomiting, diarrhea, excessive salivation. With our musculoskeletal system, you might see weight loss due to chronic stress, increased motor activity if we're pacing because of all that, because of the stress we're experiencing. And we could even see self-injury in relation to stressors, um, skin, excessive shedding. We might have lesions secondary to self-injury. And with our eyes, you can see dilated pupils as a physiological change to stress response activation too. And so why do noise aversions, phobias happen? Um, Sudden, loud, unexpected noises are a very common trigger for fearful behavior in dogs. And previous traumatic experience with loud noise is a reported risk factor. Thinking back to that first time I've ever heard fireworks example I gave earlier. And with phobias, we see very intense reactions, and they can be exhibited if the dog really doesn't have a lot of choice or control in the matter in terms of being exposed to that noise. So why does this happen with our beloved canine companions? There likely is a genetic component involved with noise phobias. If relatives of the dog are known to have noise phobia, there's a chance that the other dogs in that lineage have the condition or will develop that condition as well. Sires and dams with noise phobias should be considered as likely to pass on the condition to their offspring. So when it comes to breeding practices, if this is something we're aware of with a litter we have from a certain sire and dam, then we might need to go back and look at what those breeding crosses are and change things up to try to prevent that from happening with future litters. There can be, changes to our hearing over time that could contribute. Um, Sometimes there's even just the lack of experience early in life that contributes to this developing as well, in that the primary socialization period for, or fear period for puppies is between about like 3 to around 14, maybe up to 16 weeks in puppies. And that's the time where they're very brave and curious and exploratory. And if they don't have those experiences with all the different things they're going to experience during that very sensitive window, it's kind of that fear of the unknown. I've never experienced this before, and so it becomes really scary for me when I do experience it for the first time. Um, there's also continued learning history. I heard a quote once about once learning happens, it becomes a part of us. And it's something I say in exam rooms a lot now in terms of, if I have now learned and have continued to learn how I cope with these certain triggers that I have, and I continue to have that rehearsal, then I just get better and better at utilizing that coping strategy because that's what I need to do to try to get back down to my baseline in that situation. There can sometimes be some social transmission or facilitation with noise phobias as well. Like if you've ever had a dog who is, seeing the delivery driver come up the driveway and is barking at the window, and your other dog is completely across the other end of the house, but when he or she hears the dog at the window going and barking, then just comes running even though he or she doesn't know what we're barking at. Sometimes if, another dog who has a noise phobia starts to, display those behaviors that come with being very scared of the noise event, another dog in the area with that dog may then be like, oh, there's something we have to be worried about. I guess I need to be worried now too. Um, some suspected abnormalities that might contribute to noise phobias as well can include um, abnormalities in our neurotransmitters, those chemicals that help balance our emotional regulation, an overactive locus coeruleus, which is in our brainstem. It helps to regulate arousal and produces norepinephrine, which is our fight or flight neurotransmitter. We can see a malfunctioning amygdala, which is another part of our brain, and the amygdala is involved in, it's our emotion processing center, and it helps to control our fear responses. Um, and there can even be changes to our hippocampus, another part of our brain, which is, and if it atrophies or gets smaller, that contributes to changes in learning and memory too, because the hippocampus is involved in those processes for us. All right. The other thing I think about a lot in terms of patients who are presenting to me for noise phobias or sensitivities is if there's a potential association with pain. Especially, I become concerned about that if these noise um, phobias are relatively new for that particular patient and they didn't have something like that for, most of their life until they've come to see me. Um, there was a paper that I have in quotes there published in 2018. It's called Noise Sensitivities in Dogs, an exploration of signs in dogs with and without musculoskeletal pain using qualitative content analysis. And the aim of that paper was to explore signs of noise sensitivity in patients with and then also in patients without pain. It was a relatively small study. There were 20 dogs who presented to see a clinical animal behaviorist. 10 of these dogs were in one of the groups, the pain group, which was the clinical case group. The other 10 that did not present with pain were considered the control group. And between groups, they said that loud noises were a trigger that were common between these two groups. So the, I guess, ideal is that, that's the only difference. Of course, there can be other differences between these groups too. But in looking at pain, we had, both groups with sound sensitivities, but one group with pain, the other without. And the age of onset for noise sensitivities of the clinical cases was a bit earlier than the control group. And in terms of the clinical cases, so again, those that were experiencing pain, they received NSAIDs or nonsteroidal anti-inflammatories as part of a treatment trial, and 9 out of 10 of those patients had improvement in their noise sensitivity as well as pain in this study. I will say anecdotally before moving on to the next slide that I have had patients um, who, when I have treated them for pain, um, because I highly suspected it, and they also happen to have noise phobias too, that we would see improvement in a lot of these patients with that concurrent treatment of pain management too. All right, and then talking about sounds, so some definitions for sounds as well, in that sounds are audible variations in air pressure, and the frequency of sounds is the number of cycles per second, or hertz is the unit for sound. You can see there that human hearing is between about 20 to 20,000 hertz, and dogs' hearing is between about 15 to 50,000 hertz, with them being most sensitive to frequencies of between about 500 to 16,000 hertz. So as you can see with that, dogs can perceive noises both above and below what we can hear as well. So sometimes we have to think about things in terms of, well, my dog's maybe reacting to something like he would if, say, a thunderstorm rolled through, but there's no thunderstorm present right now. Well, maybe he's reacting in that same way because there's other noises going on that we just are not able to detect because of how our hearing ranges differ. Um, Another definition in terms of what intensity of a sound is sound loudness, which is measured in decibels. And for us, 70 decibels is considered pretty loud. For sounds that elicit stress behavior in dogs, 95 decibels has been found to elicit a stress response in dogs. And for us, of course, very intense sounds can be actually painful for us too to hear, especially if over a long period of time, and that's considered to be a higher or at 125 decibels. And it is thought, although we don't know for sure, that dogs experience the same or similar pain threshold to the intensity of the sound as we do. So I just found this chart looking through Google Images, I think. And it just kind of gives you a sense of the decibel level of some common sounds. So you have an idea of, what is kind of considered loud, and also what could even just be considered painful with those sounds getting above around like 120 decibels when we're thinking of things like gunshots or fireworks are probably up there too. Um, but I just thought it would be nice to kind of see a figure in terms of, what is kind of more of a softer sound versus an incredibly intense and loud sound. So some examples of environmental noise phobias, and again, this isn't an all-inclusive list, but some things that we hear in practice can be things like the smoke alarm, microwave, sirens, vacuum cleaner, washer, dryer, someone accidentally dropping something in the house, a crying baby, your HVAC, traffic noises, power tools, the dishwasher, the refrigerator, ice maker, noises from your TV, your phone. Um, I know over my sister's house, sometimes because she's kind of near an airport, there can be the plane going overhead. Even people yelling can be really loud too, of course. But again, there are so many other sounds that I'm sure could be on that list too. Um, so we do tend to see noise sensitivities a bit more in some breeds versus others. And some possible sensitive breeds can include shepherds, collies, herding dogs, gun dogs, but even so, noise phobias can really occur in any breed. And that's just a picture of my sister's shepherd. Um, some possible behavior changes you may see in your dogs who may have some noise phobias that have been reported in studies can include barking, yawning, lip licking, vocalizing, hypervigilance, retreating, panting, hiding, shaking, trembling, pacing, being more clingy and kind of more Velcro to you, whining, not eating, and destructive behaviors. The ones I have in bold on this slide are the ones that were more commonly seen in a study that was published in 2021 about stress-related behaviors in companion dogs exposed to some common household noises. Barking was the most common, followed by retreating, pacing, whining, hiding, and that's why I had just bolded those. The other thing that I think is very, very important is wanting to advocate for these patients who um, we are noticing these body language and behavior changes when it comes to their reactions to certain noises. In that same study from the last slide, it was a survey of dog owners, and they found that dogs reacted more intensely to very high frequency and intermittent sounds, thinking of things like the smoke detector versus low frequency and kind of continuous noises like the vacuum cleaner being on. In people who are watching human watching video clips of dogs who were having certain behavioral responses to different noises, they were actually examining also the human interaction reactions to watching these videos of the dogs. And 21% reacted to their dog's reaction with amusement and found it funny. And another 20-ish% would deliberately put their dog in this position of experiencing that trigger to elicit a certain response. And I feel like we see a lot of things on social media where, at least with my veterinary behavior lens on all the time now, we may think is funny, but now I feel like I find a lot of these videos to be not so funny because looking at things like those dogs' body language, I can tell that they are having a hard time with it. So I think a very important thing is recognizing noise phobias as a welfare concern because we know that it is, if we're experiencing that intense type of response that makes us act in that way of wanting to hide and retreat or, bark and things like that, that our companion dogs aren't feeling the best in those moments, and we want to help them out. So how do we help our patients who are struggling with noise phobias? There are three main pillars of behavior therapy plans. So on the next slide, I have our first strategy, which is environmental management strategies. What are things we can do that are within our control? Because, thunderstorms, I can't control the weather, but what can I do to help my dog out? There are, of course, medications, supplements, adjunctive products, which are also part of my behavior therapy plans for our patients. And the last category is what we call behavior modification, which are trainers and recommended trainers. And of course, Every Dog Austin can do a really good job of in terms of, when I do feel a certain type of way, how can I change that emotional response? How do I change those coping skills to do something else instead? So, environmental management strategies, that's my dog, Otter, but Again, environmental management comes from how we can change the immediate environment to reduce our pet's practice of unwanted or undesirable behaviors. Because the more I get to practice that behavior, the more I'm strengthening those neural pathways in my brain to then become better and better at reaching for that coping strategy as I continue to experience those events at later times. Um, Avoidance of the trigger can be really, really helpful. So one example I had is if we know that our dog hates fireworks and just completely panics, is pacing, hypersalivating, cannot settle and relax or go to sleep that whole night, then maybe we go out of town with our dog for the 4th of July to somewhere where we're not going to be having those fireworks so that they don't have to experience that noise event. Um, Another potential strategy can be keeping the windows or blinds closed. Sometimes when it comes to things like thunderstorms, there can be other things that happen during the thunderstorm that then predict that it is going to happen, such as there being a lightning component. And so if we can shut those, that can help. Um, Acoustic tiles can diminish noises, sometimes developing a safe haven for these patients to be in can be really helpful too. Thinking of, how we can utilize our space with our basements or bathrooms, closets, crates, etc. Trying to be away from windows as much as possible. Having comfy things to be able to rest and relax with, like blankets, having enrichment items to have our focus be on something different that we're hopefully very interested and intrigued by, because maybe it has something really yummy for us to focus on and change our emotional state even to something more positive. Because for most dogs, food is a very positive thing and elicits a very positive emotional response. Um, Same goes for lick mats, providing our dogs some of their favorite toys. And we want the space to be only for the dog so that they feel safe and secure and that, no one's going to encroach on their safe space. More environmental management strategies can be utilizing sound masking. So what that is adding sound to reduce the intensity of the fear-inducing sound. So we're adding more to kind of the ambient sound in the environment. That makes it more difficult to hear those scary noises and makes it harder for our dogs then to be able to discriminate between the scary noise and the other environmental noises that are happening. And so some ways to do that can be using white noise machines. There is a company called Through a Dog's Ears that actually bioacoustically alters both classical music and reggae music, which have been found to have a relaxing effect on dogs. And it's made to be within kind of a dog's hearing range too. So it won't get too above their hearing frequency or below, and also won't meet that sort of intensity of being too loud to be uncomfortable. Um, so again, music, sometimes people add box fans, may play audio books, have the laundry or dishwasher running, or, the vacuum, as long as those aren't the noises that the dog is worried about. More management strategies can be training your dog to wear sound reducing ear protection, and there's a lot of options for that. There are mutt muffs, which is the picture of the dog with the helicopter in the background. The happy hoodie is the pink little hood that those two dogs are wearing on the top. There's crit ear, which are like little earplugs for dogs. And then Ponix is just kind of that helmet, which helps to diminish the intensity of the sound that dog is experiencing. But very important to make sure that you're dog, if that's something you're interested in doing for helping them through their noise phobia, is they must be trained to wear it comfortably before we use it. We don't want the first time they use it to be, when the thunderstorm is rolling around and we haven't trained them to wear it comfortably yet. Because then I'd imagine that most dogs probably just want to take it off their head, and it adds to extra stress that they're experiencing, and may then even become associated with the noise itself. So we want them to wear it comfortably, that it doesn't add an extra layer of stress to them, so that they know what to expect and can wear it comfortably for the actual noise event. Compression may or may not be helpful for some dogs. A lot of people have probably heard of or tried thunder shirts before. And at least anecdotally, I'll say, it's helped some of my patients. It doesn't seem to make a difference for others. Weighted blankets is kind of the same concept as well as shirts, in that if I have something close and comfy next to me, that helps me feel safe and secure. You definitely can provide comfort to your dogs who are experiencing noise phobia to help them relax. I think a lot of times a question I get from people is that, if I am providing him with this attention, what am I reinforcing that behavior of, the pacing and panting and salivating and barking and retreating and things like that? And the answer is no, you are not reinforcing those behaviors, because they're motivated by that underlying emotional state of fear, stress, anxiety. And what our goal is to reduce that fear, stress, and anxiety to then in turn change their emotional state. So you certainly can give your dog all the love and comfort and affection you want if it helps them be more relaxed during the scary noise event. Um, and another useful management strategy is trying to plan ahead. Can you use weather or radar apps so you can get a sense of when that storm is coming through so you can be prepared? It is much better to be proactive and be over prepared than be reactive when we're already in the situation and the stress response has already been mounted, because that's a lot harder to kind of come back down from. And again, you can go out of town for predictable noise events such as, New Year's, 4th of July fireworks, things like that. And if your dog is on any medications to help reduce anxiety for specific kind of predictable events, then giving those medications in advance so that they have time to take effect for the actual noise event itself. And so the second pillar to our behavior therapy plans is that category of things like medications, supplements, adjunctive products, anything that we have scientific evidence and literature on to kind of have that basis off of, to say, yes, this can help some of my patients experience that event more comfortably. And one of the reasons I may reach for medications for a lot of these patients is because dogs with noise phobias are more likely to have other anxiety-based disorders too. I cannot think of any patient I have seen in specialty practice who has only come to see me for noise phobias. So it's very, very common for these patients to have other diagnoses, behavioral diagnoses as well. And so some common comorbid diagnoses can include generalized anxiety disorder, as well as separation-related behavior. Another reason I might reach for medications is, again, if there is late or sudden onset to this noise phobia, I am very likely looking for a medical component to explain this as well, because behavior changes are often the first thing pet owners will notice. I will also want to do a minimum database to get kind of a more comprehensive look at that patient's systemic health values, with things like a complete blood count, a chemistry profile, which will look at things like liver, kidney values, electrolytes, blood sugar, etc. as well as a urinalysis to make sure, again, that the kidneys are functioning appropriately, that there's no other underlying medical thing that is going on that can contribute to just exacerbating any sort of anxiety-based behavior, such as a UTI or crystals in the urine and things like that. And then, of course, pain, which we talked about earlier, can be a big thing. I know my residency mentor, one of them, Dr. Pike, her dog had developed a noise phobia that she had never seen him have before, when he was actually being treated for pain, and that completely resolved after his treatment was successful too. And so always something I'm looking out for. Another reason I'm going to reach for medication is because a lot of times people may come to me and say, I thought over time that my dog was just going to grow out of this and it would get better, but it actually got worse. And what we know about anxiety-based behaviors is that they definitely will worsen over time without intervention. One of our mantras, I guess, at work is that we grow into our anxiety, we don't grow out of it. And so we have a lot more success if we're able to intervene sooner rather than later. When it comes to medication, we have a couple of different categories within that category too. We have short-acting medications as well as longer-acting psych medications. And so when might I use which of the two? Short-acting medications, they can vary in onset and with how long they act. The most common ones I typically prescribe may take anywhere between 30 minutes to maybe a couple hours to take effect, and they can last anywhere from about like 4 to 6 to maybe up to 12 hours in our system. We want to use these when we have predictable noise events happening because, we can't predict if and when any and every noise event is going to happen. When it comes to thunderstorms, a recommendation I'll make to a lot of our clients with dogs with weather-related phobias is that if there's like a 20% chance that that storm is going to roll through, we're going to give that medication 2 hours before our weather app is saying it's going to come through. So again, we're being proactive versus reactive. Short-acting medications to reduce anxiety can also be used with long-acting psych medications too. And with those long-acting medications, a reason I might be reaching for those in dogs with noise phobias is because, again, they might concurrently have other general anxiety-based disorders, where that's going to be a benefit for their just kind of day-to-day baseline, and can be very helpful for unpredictable and frequent noise events too. We can't plan for every noise event, and if we say live in Washington, D.C., where a lot of my clients come from, there are constantly noises, there's traffic, there are people and many people living in apartments, so there are noises in the hallway, hearing your roommate, hearing, people and the dog are hearing other people's dogs in the complex. If there's just all these noises all the time that are making it so hard for me to be able to rest and relax, then I just want to take that day-to-day edge off for that patient too. So some short-acting medications that we have in and utilize for our patients, one is called Sileo. It is in a class of medications called alpha-2 agonists, and it's an oromucosal gel. So that means that it gets absorbed by our gum tissue, and that's where we apply it. It is an FDA-approved medication for canine noise aversion. Something to watch out for this product is that it can potentially cause some sedation, but it can also have an anxiolytic effect or anxiety reducing effect. Sometimes sedation is actually preferred in these patients too, in terms of I'd rather you just go on a total stress vacation, sleep through the noise event, and not have to experience the panic you might otherwise feel. It can be very effective in reducing kind of acute fear and generally seems to have minimal sedation in a lot of patients. It's generally very fast acting. It can take about 30 minutes to take effect, or it can just be given at the first sign of distress for kind of those surprise noise events where our patients might need some extra help. And it can also be redosed every 2 hours for a total of 5 times in a 24-hour period. In a study on Sileo, 72% of pet owners observed a good or excellent response to using the product compared to 37 in the placebo group. And one thing I will say about this product is we always want to show our clients how to administer it appropriately. So I wonder if you can click on the video link. It's a short video. That the company's made to show how to administer it appropriately.
Alleviate acute anxiety and fear associated with noise in dogs. It's good to anticipate anxiety triggering situations and administer the medication in good time. You can easily administer Sileo to your dog at home. Start by putting on a pair of disposable gloves. Here's what you need to do to administer Sileo correctly. The Sileo oral syringe contains medication for multiple doses. When you use the syringe for the first time, set the dose by turning the dosing ring towards the tip of the syringe. For example, if the dose prescribed by a veterinarian is 3 dots, turn the dosing ring until you see 3 dots between the dosing ring and the syringe barrel. Check that the edge of the dosing ring is exactly at the black graduation mark. When you are confident that the dose is correct, remove the cap from the syringe. It's supposed to be tight. Don't lose the cap so you can close the syringe after use. Take a firm hold of the syringe. You can hold the dog's snout in place with your other hand. Gently place the syringe between the dog's cheek and gum. Sileo is absorbed oral mucosally. Do not open the dog's mouth. Unlike other medication, Sileo should not be swallowed as it does not work if swallowed. Press the plunger until the dosing ring causes the plunger to stop. When using Sileo, your dog should be able to interact normally. Place the cap back onto the syringe. The product is sensitive to light, therefore it should be stored in its original package. The fear-eliciting event continues and the dog shows signs of anxiety and fear again. Redosing can be done when 2 hours have passed from the previous dose. The product can be dosed up to 5 times during each noise event. You can find more detailed instructions on the leaflet inside the package. Please read them carefully.
All right. And then the last thing I will say about Sileo is another thing I will always tell or will try to remember to tell clients is that when you apply the medication to the gums, it can turn the gums white. And that's totally normal because it constricts our blood vessels. It's temporary, it will go away on its own. But sometimes people, if we haven't told them that, have called being like, I did this and his gums turned white and now I'm really worried. It's just going to be in the location where you applied the medication and it will resolve on its own. Another short-acting medication I prescribe very frequently is called clonidine. It is also in the same class of medications as that Sileo was. It's an alpha-2 agonist, and it helps to block the release of norepinephrine in that location in the brain we were talking about at the very beginning, the locus ceruleus. And again, norepinephrine helps us better regulate our fight or flight response, so we're not so apt to get into that sort of mode. With it, the regulation that clonidine will help us with. So norepinephrine, it's released as a response to acute stress. And in a 2011 study, there was a group of dogs who had different sort of behavioral diagnoses like separation anxiety and also noise phobias. And the other group of dogs had more fear-based behaviors. And in both groups, there was reported improvement with these patients being on clonidine. Clonidine, it takes about 90 minutes to take effect, and it can last anywhere between about 6 to 8 hours. Another short-acting medication that I feel like a lot of people in the veterinary world are familiar with is called trazodone. Trazodone, it is a serotonin antagonist and reuptake inhibitor. And there was a retrospective study done in 2008 that had 56 dogs with anxiety disorder. And some of these dogs had things like storm phobias, noise phobias, or a combination of those phobias with other diagnoses as well. Trazodone was added as an adjunctive to help reduce anxiety, along with longer-acting medications such as selective serotonin reuptake inhibitors or tricyclic antidepressants. Seem to be pretty well tolerated within a pretty wide dosing range to have a calming effect when given daily or as needed in this study population. And with trazodone, it can take about also 90 minutes to take effect. It lasts a bit longer, about 8 to 12 hours. And then another short-acting medication that is prescribed quite a bit is called gabapentin. It is an alpha-2 delta ligand, and it is used in human medicine as well as veterinary medicine as an anti-epileptic and analgesic in that it has pain properties as well. It can help facilitate more calm and relaxed behaviors. And in a 2021 study that was a double-blind, placebo-controlled crossover trial, they had found that it was beneficial in reducing a fear response in dogs who had storm phobias. It's very well tolerated. Um, I always tell clients to watch out for some of the most common clinical signs or adverse effects we might see with it, which are typically sedation or ataxia, which just means having like an uncoordinated, kind of stumbly type of gait. Takes about 90 minutes to take effect, and it also can last for about 8 to 12 hours. And then the last shorter acting medication I was going to touch on is in the class called benzodiazepines. There's a wide variety of different benzodiazepines out there. Lorazepam and Xanax are some common ones. And yeah, benzodiazepines, they act on a neurotransmitter called GABA that helps to provide sedation, anxiety reduction, can even provide muscle relaxation. Very, very helpful for kind of really panic type of responses in patients. It may increase appetite. You might get the munchies. I wouldn't say it's common, it's more likely than some of the other medications I might prescribe to cause what we call like a paradoxical reaction, in that the anticipated effect is calm and relaxation, but it might actually cause maybe more agitation or restlessness. So we always want to test this and pretty much all of our short-acting medications in advance so we know what the anticipated effect is going to be on our patients. With benzodiazepines, there is all the potential for the development of a tolerance the more frequently it is given. A lot of benzodiazepines are pretty fast acting, can take anywhere between maybe 30 to 60 minutes to take effect, and they can last, depending on the medication, between the range of about 6 to 12 hours. So in thinking about our longer acting medications, some common classes that I might prescribe are SSRIs. Reconcile is actually the dogs and FDA approved version of Prozac or fluoxetine. We also prescribe paroxetine and sertraline or Zoloft a fair bit. SSRIs, they help to inhibit the reuptake of our coping neurotransmitter, serotonin, and in doing so can kind of just generally take the edge off of our day-to-day anxiety and reduce anxiety, impulsivity, and just kind of overall improve mood too. Tricyclic antidepressants are another class of long-acting psych medication. Clomicon is an FDA-approved medication as well in dogs. And so, along with medication, I might reach for supplements in some cases too. I come across clients who are very uncomfortable with the idea of using medication and might want to go the more natural route. Another nice thing about supplements is that they don't require a prescription. They are over the counter. And so you don't actually have to see me to utilize these products. One supplement that is out there is called Anxitane, and my mentor, Dr. Pike, actually did a study on this in 2015. Anxitane contains L-theanine, which is an amino acid found in green tea leaves. It is highly palatable. Even my cats take this without issue. They just eat it right up. And it also helps to increase GABA, like we were talking about with benzodiazepines. And it has a little effect on dopamine, which is our kind of pleasure, reward center, feel-good neurotransmitter, as well as that serotonin, which is our coping molecule. In that study that Dr. Pike did, she was looking at storm-sensitive dogs and did see, in general, a significant decrease in their kind of global anxiety score, and improvement in their time to recover from noise events too. So there was a decrease in stress-related behaviors such as drooling, panting, pacing, as well as hiding. And owners were generally very satisfied with how their dogs responded to treatment with Anxitane. Another supplement is called Zilkine. It comes from a cow protein, a hydrolyzed milk protein. Also acts on GABA like benzos do, and can, let's see, in a study that was looking at just kind of general emotional disorders in dogs, it did help to decrease their general stress scores, and it's generally considered very safe too. No adverse side effects were reported in that study. Probiotics can be incredibly helpful as well. I just saw a patient last week, and the owner emailed me about the Calming Care probiotic I started this patient on just this week. So it's been 1 week, and she was just like, wow, her stool has already improved a lot, which I think is helping her behavior, which is awesome to hear. Some probiotics I prescribe frequently are, again, that Calming Care probiotic. It has a specific strain of probiotic in it called Bifidobacterium, which has been shown to help with anxious behaviors. It has, in one study by Purina, helped to show a reduction in vocalization, jumping, pacing, and spinning in dogs in their study. And it can help dogs cope with novel sounds, which could be really helpful for these noise phobic dogs. Although it does take some time to take effect, it can take up to 6 weeks before we see a behavior effect with it. Visbiome is also another probiotic I really like. It has that same specific kind of calming probiotic strain in it, but it also has a bunch of other great probiotic strains for just general gut health. Another adjunctive product that I will consider for patients is pheromone products. Pheromones are chemical signalers that are species specific and are a form of communication between, that specific species. They are a form of communication, and commercially they have synthetic versions of these pheromones that um, help to facilitate more calm and relaxed behaviors. So an example is that when a dog has a litter of puppies, she will actually release this appeasing pheromone from her mammary glands to help facilitate more calm and relaxation with her puppies while they're nursing. And there are no reported risks or contraindications with these pheromone products. A couple of those pheromone products. So these are the ones I actually trust because they actually have some studies behind them. Thunder Ease was also called Adaptil. Comes in different versions. It comes in a diffuser that you can plug into the wall. Comes in a spray. So if you have a safe little coven for your dog to be able to settle and relax in during, say, a thunderstorm, we might spray this a little bit before that storm rolls around to help facilitate that calm. And it even comes in collars that the dogs can wear, and I think last about a month. Zenadog is another pheromone product that has a diffuser, that little container with the brown lid on it. You can just place it anywhere you want to in your house, and it lasts about 2 months. Zenadog also has a collar version of their product too. And the last thing I wanted to talk about was behavior modification and what that means. And that's probably where every dog comes in to play for you guys too. Um, Counter conditioning is a really important step for us, and it's a process in which we train our patients to perform a behavior or response that is not compatible with the behavior they're currently presenting with when the problem evoking stimulus is present. Counter conditioning is often paired with what we call desensitization, which is the gradual exposure and habituation to a stimulus that can lead to a problem behavior, the result of which is to raise the threshold at which an animal responds inappropriately. So we use this to increase an animal's ability to control its response so that it elicits a desired versus undesired behavioral response. With counter conditioning and desensitization, when it comes to noises, I think the hard thing is that what we find, and I don't know, maybe before the Q&A, every dog Austin can tell me what they think too with what they see with their patients. But patients don't generalize kind of like fake noises, like playing a recording of storms or fireworks or something like that very well when it comes to like the actual unpredictable and real noise event. And for counter conditioning and desensitization to work, we can't have patients who are way above threshold while training. That's not a very successful place for our brain to actually do the learning that we want to do because we're in fight or flight mode. And so not necessarily a technique we use often for our noise phobic patients, but that doesn't mean that you can't try it and that it won't work for your dog in particular. What we often do instead with our behavior modification is trying to change the focus by using things like redirection away from the noise, doing look at that in terms of they recognize the noise, but then they can look away from it and do something else. Nose work can be really fun. Sniffing is very decompressing for dogs. So if they have something to do and sniff out, can they stay more focused and engaged in that activity instead of focusing on the noises? Pattern games can be really helpful in that if we teach a dog how to follow a certain pattern with those games, it just is a way to maintain more predictability. Predictability makes us feel less anxious. So those are things we can do with our dogs during the noise events. And we can also do relaxation training in terms of not only do we have a physically relaxed body, but that can also help have us have a mentally relaxed brain, I guess, too. Um, but yeah, sniffing, chewing, long-lasting enrichment items are all great ways that dogs can decompress and focus on something different. And so I just have my reference pages if anyone wants to look at those, but that's everything I have for you guys today.
Awesome. Thank you guys so much for being here today. That was a really awesome talk. Thank you so much, Sameera, for being here. If anybody has any questions, you can go ahead and pop those in the chat. We'll take a couple questions if anybody has any. Let's see. Oh, thank you. Thank you, Sarah, for being here. I really appreciate everybody who's come to join us live for this chat. It makes it so much nicer when we get to see everybody's beautiful faces on camera and get their reactions firsthand. But yes, awesome, awesome presentation and very, very